Heavy menstrual bleeding is the most common cause of iron deficiency in young women.
You should know your iron stores.
Heavy menstrual bleeding is the most common cause of iron deficiency in young women. And iron deficiency will impact their ability at school, their concentration, their IQ, their memory, as well as increasing the risk of depression, anxiety, and then, of course, the problems with pregnancy. We do not want women entering pregnancy who are already very iron deficient because pregnancy is a huge drain on iron stores. And we know from worldwide data that 30% of young women are iron deficient. So therefore, it's not surprising that 40% of pregnant women are iron deficient. So we really do need to raise awareness of this problem, empower young girls to think about their periods, to seek medical advice, to know if their periods are heavy, because everyone only knows their own menstrual flow, not anybody else's. And then to ask their doctors about their iron status.
Menstrual health is often a neglected area in a woman's life, very unfortunately. I suppose because it was being stigma to talk about having menses, having, during that period of unclean time, especially for the Asian perspective and perhaps African as well. Now, menstrual health is extremely important. We are partly to be blamed as well, because whenever there's anyone who brings up the issues, say a young girl who talks about, their menses and whatnot, we tend to push them, brush them aside. We tend to tell them that this is normal, this is part and parcel of being a young woman growing up, but it is not. We should pay attention. We should talk about this so that we can address the concerns that they may have, and which I call it the paternalism of doctors who thinks that they know better. They know the 13-year-old child being misdiagnosed as having some mental health issues and neglected to look into other aspects, which is so easily that can be settled so easily, you know. And this is the problem that we see among our healthcare workers nowadays, where you are very tunnel vision. You only look into your own specialty and not look into the other aspects. Depression, once again, or perinatal mental health, is once again tied up with iron store of a patient. It's very easy to make sense of it. When your iron store is low, you tend to be lethargic, you are not as energetic, and one thing will lead to another. You feel bad about yourself. All this thing is a vicious cycle.
It's really difficult to distinguish between postpartum depression and iron deficiency. The symptoms are very similar. Iron is needed for every cell in the body, which includes the brain cells. And so the brain cells are not rich in iron, they won't be functioning properly. There's more likely to be a risk of depression and also the fatigue that comes with iron deficiency.
But what I wanted the listeners to know is that it's not just your hemoglobin. You should know your iron stores. All right. And why? Because the effect could be there before a person becomes anemic, which means the iron deficiency is so severe, so much so until the RBC is not being produced in adequate amount. So, but the effect is there even at the very beginning of low iron stores.
Everyone only knows their own menstrual flow, not anybody else's. We really do need to empower young girls to think about their periods and then to ask their doctors about their iron status.